Okay, great. So we're going to get started. My name is Melanie Rhonda, and I am an infection preventionist for IPRO. And we're talking today about, we're continuing our conversation with the IHI framework for improving joy in work and bouncing back from booster shots to bouncing back, session 4, psychological PPE. Josh is joining me. Thank you for joining to help out with the conversation. I wanted to just take a minute, realizing all of you are probably starting to see some rise in COVID cases. So I did want to highlight the fact that we developed a friends and family vaccination clinic toolkit. So if you are interested or may think that could help improve your COVID rates in the facility, we put together all the steps you would have to partner with a community organization to offer vaccines to your staff family, your visitors. You could extend it out to the community for better access to vaccine. Certainly, we know that getting more people vaccinated will protect the residents and drive some herd immunity and reduce hospitalization and the negative impact of COVID. So we put together that toolkit. We will put it in chat. I don't know, Josh, if you can put that link from the resource library, the actual toolkit link in there, if you can find it. If not, I can do it at the end. But we are willing and available to help you host the clinic in whatever ways you need from us. So please feel free to reach out to us. And I think it's important to have that conversation. And go ahead and put in chat who you are and where you're from. And you know what I want to know today? Today, I'd like to know what your favorite dessert is, because dessert is very important to me. So what is your favorite dessert? And we're going to get going with the presentation. Thanks for joining. Just to kind of recap, Booster Blitz was our first clinical series, and that was over, and we thought, well, what can we do to support the facilities at this point? And we realized the toll this has taken on everyone's emotional well-being. So looking into some different resources, the IHA framework for improving joy at work really resonated with us to support you in your needs. And we have a lot of tools to help you implement some of the joys at work concepts. So, over this time, we know BA2, booster shots, there's lots of things keeping us up at night. I'm a former director of nursing, and I was working in the field at the beginning of the pandemic. And I certainly realize all of the different things that have been a struggle for all of you. So together in the series, we discover some ways to rebuild our workforce, discover what matters most, and find ways to impact staff's lives in a meaningful way. Joy in work is about cultivating a sense of purpose, meaning, and fulfillment. Why joy? We don't want, when you're a nurse and you're working in healthcare and you're providers, we're very science driven. So a lot of times thinking about that emotional side is hard. We're the get it done group of people. We've got a problem, we got to get it done. So why joy? Well, right now we are dealing with significant burnout. We're significant turnover, loss of experience. That's been a huge impact to healthcare in general. People are leaving the profession. They're not only leaving their jobs, they're leaving their profession. And that's a huge issue. We have people, all of you working in a facility right now have or had that one person. Survey team comes in, they're asking you a hard question. You're like, I know who knows the answer to that. I got to find out the historical perspective of that one. Where did that policy go? I got to figure that out. And we've lost a lot of those folks because they actually decided that they were going to go ahead and retire because of the pandemic. Super hard losses for the organization. I love it. There's a lot of cheesecake. We got cheesecake and pie, any kind of pie. Great, thank you guys. I like all desserts. So what about you, Josh? All desserts?
Yeah, ice cream is probably my favorite. I live in Massachusetts, and I know we cover the whole New region. Some areas are warmer than other, but I probably have ice cream any day of the year, even in the winter.
Great, great. So thinking back to the why joys at work, I mean, look at how happy just having a conversation about dessert is. How
Yeah.
might that impact your staff by thinking, oh, let's have a dessert day? Gosh, you'd have some happy staff that day. So, thinking about it, we want better outcomes, staff stability, and intrinsic motivation. I think this is a time to go back to why are you doing what you do? You all have worked so hard during this time, and you have done things that other people to do maybe wouldn't be able to do it. There's a lot of things that are so impressive about the world of healthcare right now. And getting back to the reason why you started to be in this profession, especially when you're so burnt out and so stressed out, and your staff is feeling the same way. Why did they decide to be a CNA? Why did they decide to work in a nursing home, to be a housekeeper? They touch so many people's lives. And it's important to remember why you're doing it. So over the last 4 weeks, we've talked about giving people assignments and walking away with some questions. So the first assignment was talk to 5 of your staff and figure out what makes a good day for you, what makes you proud to work here, when are we at our best, and what does that look like? And then what did you learn? We were looking to hear some feedback. So if any of you actually went out and asked those questions, and maybe today is the first time you're joining us in this series, if that's the case, write these questions down and see if you can go out and ask those questions. We would love to hear from you what you learned, or maybe you got some pictures. When we ask when are you at your best, maybe you have a picture of what that best looks like and what that feels like. Share that with us. We'd love to hear that. So the next week we talked about 15 seconds. 15 seconds can save someone else 30 minutes. So how can you manage your day and save that do something for 15 seconds that saves somebody 30 minutes? So one thing I think of, I use the last of the paper in the printer. If I replace it, I'm going to save somebody a great deal of time, because they won't have to go to the printer, realize it's out of paper, go find the paper, put it in, then maybe go back and reprint. It's just a frustration that doesn't need to happen. So if I filled that the copier, I would have saved that person 30 minutes, possibly. A little cheat sheet, so you could ask your staff, what is your mission? What 15 seconds can you do to save 30 minutes? Maybe it's restocking the glove boxes in every room before you leave your shift. That would save somebody some time. What were you going to say?
Yeah, so the PPE bins were something that was brought up a lot in these conversations. How if you're, the PPE is starting to get low, restock it so that someone else doesn't have to go do it later.
That's an excellent point. Absolutely. So, and maybe you could ask somebody if they want to take that on. But this is just a nice way to say, this is something I think matters to me, and I think it would help my coworkers. And this is when I'm going to start it. And when I've done it, I'm going to put a little check in the box. So this is an example. Thanks, Josh. I like this slide, and I don't want to lose sight of this. The world is a better place because of our work. Is it? Build systems to reflect love and care within your settings. Heal people and enrich their lives. Lead with kindness. Show caregivers that tangible and intangible results of their purposeful work. I know, Josh, when you were an administrator, you had a specific slogan or thought. You want to share that?
Yeah, the mantra that I always led my facility with was, it's all about love. So I truly tried to integrate everything that I did as an administrator within my facility on the basis and foundation of genuine love for my staff, for my residents, and this is, there's a difference when someone is showing you genuine love and respect and compassion, and once you show that to people, it becomes infectious and spreads throughout the whole facility.
It's such a great point, and I think that's some of the steps that we learn throughout is showing that compassion and that the individuals actually matter, make a huge difference. Thank you, Josh. So week 3, we went over the 4 steps. Ask staff what matters to you, identify unique impediments to joy and work in the local context, commit to a systems approach to making joy and work a shared responsibility at all levels of the organization. So I think that's important. Is everybody saying the same language? Is everybody committed to the mission? Something to consider when as a leader or as part of the team, how are you impacting the joy? How are you showing support? How are you pushing down and pushing up the joy? So just think about that. Use improvement science to test approaches to improving joy and work in your organization. We've just put together some of these kind of fun looking posters and flyers, just so that you have access to them, and things to really think about. Keep hydrated. Maybe having lunch away from the desk is important. And Sonia Sparkles is the creator of this, so you can find that on Sonia Sparkles. And I think especially with COVID, we have to acknowledge our staff that's working on the COVID unit with all of this extra supplies on. Summer's coming, it's hot. They're wearing face shields and N95 masks and gowns and gloves. It's hot, it's sweaty, it's difficult. Are you offering extra breaks for those folks? Because it's a very long day working on the COVID unit. How are you trying to protect their health and well-being? Just, think about that. So here's another hierarchy of well-being and needs at work. And we'll be talking a little bit about some of these things. This is a nice tool as well for you to talk to your leadership team or your staff about. And what I thought improvement was, this is another tool. I love this because what I thought is we saw talk about quality improvement and our staff are like, I don't know what that is. I don't want to deal with that. Just I'm going to work, leave me alone. So, and it's full of complex tools and terminologies that are hard to understand. Let's not do that. What improvement actually is, a simple and effective process. Let our staff understand we are trying to make simple and effective process. Everyone has ideas and can do improvement. Inspire and believe in yourself and make the change. So there's a very easy way of looking at quality improvement to not make it so complex. So that's also available. So the week 3, which last week, we asked you to go ahead and take the IHI white paper and read it. Read it as a team, get it out to your team, consider how you could use it in your setting, if you could use it, and go to one link from this or previous presentations, or just Google joy and work and see all of the different activities that are out there. Lots of organizations have taken this and made a lot of tools and resources and videos. There's some great material out there on joy and work. This week, we're going to talk about psychological PPE, personal protective equipment. So we have had an abundance of conversation about PPE in general, right? Personal protective equipment. And we're talking about the external covering your body. But we need to also talk about the internal, the mental health. Psychological PPE, there is a significant interest in healthcare in the concept of psychological PPE, individual and system level actions owned by the unit or the team leaders that provide protection and support for staff's mental health and can be deployed both before providing care and after the end of shift. So protecting your staff against burnout. And clearly that has been a problem. Josh, have you learned of any interesting ways people have protected their staff against burnout or thoughts?
Well, speaking as an administrator, there were times where I would catch nurses sitting at the desk at the nurses station eating their lunch, or even skipping their lunch to do stuff, and it would break my heart. And I would make them like stop, like give this to someone else right now and go take your lunch. Like the amount of relief for someone to have just to be able to sit down and eat their lunch, or even to go to the bathroom. I know like don't even go to the bathroom on their shift either. It's just
it's a badge of honor when you're a nurse.
Yeah, it's the amount of psychological comfort that you can provide someone by giving them, by meeting their most basic needs like we do for our residents, for your own staff. I think that's monumental, and I think we really need to focus on that, leaders.
Yeah, that's a great approach. And I think, you know, it's interesting because I learn so much when I have these conversations with people, because me as a director of nursing, my background, I'm a registered nurse. I have a master's degree in infection prevention and control. So here I am. Well, OSHA says you can't eat at the, so I'm coming at it from the regulatory, and you're coming at it from the mental health well-being, and that's so great. And so maybe that's the shift we could make. You know, people can't eat at the desk for OSHA requirements. So can you shift it to say, we care about you and we don't want you eating at the desk, because we want you to take that time for yourself away and sitting at a table. That is such a great way to look at it, Josh. Thank you. So here is your psychological PPE. Let's talk a little bit about this to promote mental health and well-being. So for an individual, take a day off and create space between work and home. I got a great tool to show you after this, but I question you to think about, are you giving your staff the time off they're requesting? I realize staffing challenges are so great. It's so hard to give people days off, but if people are requesting it, there might be a variety of reasons. Are we giving staff the time that they need? Avoid publicity and media coverage over COVID-19. So I love science and I want to be involved and I want to know, but I cannot manage all of the negativity that comes at us from social media, from Twitter and Instagram and the news. And I need to take a step back and I have to shut it off. It's so important to realize your own limits and say, okay, I can't talk about this right now. And I often do say to people, I really don't want to talk about that today. Especially if you're just out in a community, I can't have the conversation about vaccine, not vaccine. There's times where it's just too overwhelming depending on who you're talking to. So, you know, just realize that there might be a day you need to shut the news off. Receive mental health support during and after crisis, super important. Facilitate opportunities to show gratitude. Reframe negative experiences as positive and reclaim agency. So we heard in a different call, we had heard how some facilities have recognized with the changes that they made during COVID to manage the staffing crisis and the care of the residents, they actually made some changes that they're going to stick. That's the path on better ways of doing things, and they're going to continue to use ways. And I think that's an opportunity to really highlight the positive experience and making sure that we show that and we talk about it. As a team leader, limit staff time on site and shift. So that's another hard one, because if we have those staff members that are willing to work the doubles over and over again, that's the easiest person to ask. But
that's a slippery slope.
It is a slippery slope, Josh, and definitely people get tired. They get really tired. I recall this one time I had a staff member and I was at home and she was on the phone with me, and relief did not come in, and this was pre-COVID actually, and she had done a double, had come in, and she had done the double the day before, come in. They had a really rough day. They had to do treatment for everybody for an infectious disease. And she was, I can't continue to work. I'm like, I need you to stay though until somebody else comes in because you can't leave the patient. But she just was begging for the fact that she could not stay any longer. And you have to hear that person. You have to hear. So next thing, design clear roles and leadership. Train managers to be aware of key risk factors and monitor for signs of distress. I think that's super important. I think as nurses, for those that are nurses on the phone, we really do wear a badge of honor that we can do this. We aren't going to quit. We got this. And recognizing when people start to have signs of distress and acknowledging it and helping them is very important. Make peer support services available for staff. We'll talk a little bit more about that. And another great idea, pair workers together to serve as a peer support in the buddy system. We've often done that for like mentoring, but how are we looking at it during this crisis time? It could be a very good option. So I thought this was great. This is the North of England, UK instituted a going home checklist to support the staff between the workday and home. So this is what it's hanging at the time clock. Take a moment to think about your day, acknowledge one thing that was difficult on your shift and let it go. Be proud of the care you gave today. Consider 3 things that went well. I love the fact that they acknowledge one negative and said, think about 3 positives. That's so important. Check on your colleagues before you leave. Are they okay? Are you okay? Your senior team are here to listen and support you. Now switch your attention to home, rest and recharge, and thank you. I just think this is so meaningful. And especially if your leadership team is aware and open and want to hear the feedback. So listen, improving your staff well-being. So here's some key concepts. Listen to staff and respond to concerns about well-being. Shift your language from what is the matter to what matters to you to elicit meaningful conversation. If I say to Josh, what's the matter? Or if I say, hey Josh, what matter? Are you more likely to feel comfortable talking to?
Yeah, framing is so important.
Open, you want your staff to be able to feel open about sharing their feelings, and you have to demonstrate that you actually care for them. So I recommend, if you don't have time to listen, don't just do that random walking through, hey, how are you doing, and going, because they may actually want to tell you something. So if you really don't have time to have the conversation, you need to be present in the conversation. Provide transparent communication. As the situation with COVID has been so rapidly changing and the staff is looking for the leaders to provide reassurance and guidance. You may not have all the answers, and that's okay, but be honest with what you know and be honest with what you don't know, and have real-time conversations with the staff. The cases of COVID are really rising in the community. I want you to be aware that that's going on. I want you to just be aware so you can protect yourself and you can protect your family, and make sure that, if you need to wear masks or you want to maybe not do some things, I just wanted to make sure you're aware that these things are happening. Promote mental health and well-being. Staff need to have support systems to take care of themselves too. Getting enough sleep. So those people working these 16-hour shifts and living an hour away, they're not getting enough sleep. Eating well, engaging in physical activity, and maintaining social connections. We certainly had learned during COVID that people need people, right? You really do need people. Our animals need people. It was a lonely time for many, many people. Think outside the box with this one. So some organizations have put together some well-being comfort boxes that include snacks, well-being resources, toiletries, positive messaging. Some organizations do wellness spaces where you can sit down, you can relax, listen to easy music, some lavender, some people. I mean, there's a lot of different things that people are coming up with. Offer support where and how the staff need it. Employee assistance programs, maybe pastoral care, peer support, maybe connecting with a hotline for mental health and teletherapy support. That might be something you can work on that can help your staff. Organize ways to ease the burdens of the staff. We assume we know what the staff's burdens are, but do you really actually know what the true problem is? Connect with your community and see what's offered out there. Is there support for meals or childcare or transportation? Is there other support services your staff needs? You need to figure it out and then see what's available for them. So this one's going on long. I gotta rush now. So physical and psychological safety. Hear me. Listen and act on lived experience to understand and address concerns to the extent you're able to. But hear me. Conduct frequent, brief well-being huddles to learn about current pressing issues. Don't assume you know, since concerns are varied by individuals. I love this. Ask what concerns do you have for patients, yourself, or the team. Sustain joy and work. Continue well-being huddles to learn about current pressing issues for staff and focus on what matters most to care teams. Listen, do not interrupt. Don't ignore the bright spots. Ensure your understanding by confirming, here's what I hear you saying. Do I have that right? Because you realize with communication, so often you're walking away with the wrong idea. These slides will be available. I just have to get them 5-way compliant and then they'll be available. So I'm just going to do a couple of these. Physical and psychological safety. Protect me. I matter. Protect me. Reduce the risk of acquiring COVID-19 and being a transmitter to the families. Do be safe. Don't make things up just to have an answer. That's the worst thing you can do. Steps to try, reinsure and inform. So keep reinsuring your staff and keep informing them. Sustain joy in work. Establish and support a physical, safe work environment. Conduct assessments. Care for me. Provide holistic support for team members and their families if isolation is required or other. So care for me. Do identify what support looks like for staff and their families. Again, don't ignore the personal and family toll on staff, but don't assume you know what they need. Ask, what would support look like for you today? And today could be different than yesterday. Address the basics: food, medicine, safe housing, PPE, childcare. Assess effective support systems for all. And I realize this is a lot of work to do, but if you can get this joy and feeling of positivity in your building and the feel of my company cares about me, you'll see some staffing changes. People will stay. So more ideas. All team members be responsive to feedback. It's hard sometimes to hear what people have to say, but making sure all your team members understand and can listen. Senior positions, leadership roles, give staff flexibility where possible regarding working hours, super important. Demonstrate trust through delegation, not dump. And I think that's really important. You don't want people that feel like you're just dumping the work on them. Reduce the blame culture. Blame culture makes it so that people don't report things, they don't talk, it's a very challenging place to be. Cultivate a culture of joy, not fear. Create a speak up culture, super important. Empower the team, develop solutions and directions. So they're coming to you with a problem. So then the next question is, do you have a solution to this problem? I'd love to hear what you're thinking. Involve the team in decision making and listen and take action to address issues. So this week 4 challenge, I suggest that you take 1 unit, touching base with a touching base huddle, 5 to 10 minutes. Ask, what concerns do you have for the residents, yourself, or the team? Take the time to listen to your staff. And before ending the huddle, ask, what is one strength with the resident, yourself, and the team? If you have more time than to just do it with 1 unit, then please reach out to all of your units and do it more than once. So you can start getting the feel. Staff will be very happy that you take the time to listen to them. Then I just put some resources in there. I still continue to just love this joy in work. And this again is Sonia Sparkles, so you can look that up and you can have access to it. I'm going to stop sharing. And if you have any questions, please feel free to ask. I see Josh put in Maslow's hierarchy of needs. If we can't even ensure our staff basic psychological needs of sleep from working double after double or having time lunch, we're in trouble. Yeah, that's true, Josh. And Josh put in there the Friends and Families Toolkit, and tomorrow at 11 is the IP3 office hours, and we're talking about building the business case. So if you have a new issue or something you want to bring to leadership and get the support, we're going to talk about how IPs can do that. We're really excited about that program. And I'm going to be quiet for a minute. I know we're 2 minutes over, but if anybody wants to unmute their phone or put a question in chat, please feel free to. Josh, is there anything you'd like to add?
No, I think you did a great job, and I think this is a really important topic. Like I put, if we can't even get like the physiological needs of our staff, of making sure that they take their lunch and everything. I mean, that's just, you know, the basics that we need to start working on. And, you know, there's a good foundation, good place to start, making sure that everyone has their lunch.
Sure. Any questions? Thank you so much for joining us today. We're glad you had the time to join, and we will hopefully see you next week.